All here. Good afternoon, everyone, and a very warm welcome to all the Yodhas present here for the workshop today. I am Saloni Sethi, founder and CEO of Genuel Health, a Yodha ambassador, so to say, and your host for this afternoon. Without any further ado, I'd like to introduce our speaker for the day, Mr. Samyak Chakrabarty. Uh, Samyak Chakrabarty, founder and chief architect of Workforce, is a virtual world where professionals enhance their workspace intelligence and master soft skills. With over 18 years of entrepreneurial experience, he's on a mission to empower humans to outsmart artificial intelligence at work. He's been featured by Forbes as one of the most influential young entrepreneurs and has founded several social impact initiatives such as the Green Bhatti Project, India's largest one-on-one mentoring program for youth, and Operation Black Dot, a campaign to increase voter awareness and participation amongst college students. He also has a passion for youth diplomacy and peace building, having organized and chaired the first ever Indo-Pak Youth Peace Summit and built the country's largest MUN platform, India International Model United Nations. He has also been appointed by the UN to preside over the annual Young Changemakers Conference. We welcome you, Mr. Samyak, and looking forward to the session. Over to you.
You can hear me, no, I don't need the mic.
The recording
Yes, these were divided three teams. First two rows, then the last.
Thank you. Thank you for the very narcissistic introduction on my side. It's my team. One disclaimer, I'm 25% less on energy, so you'll have to help me because I left Bombay at 6 a.m. and as you know, Microsoft plus rains made sure my flight left at 10:30 a.m. So I'm obviously knackered. But so you'll have to add to the energy to help me. All right. So let me start with telling you what this session is not. All right. This is not a soft skills training session. Because if, for example, one key soft skill that everybody knows or everybody talks about is emotional intelligence, if anybody could learn emotional intelligence in a session, then I know all wives and girlfriends would first send their partners for a certification course on EQ before getting married or dating. But clearly emotional intelligence or any of these cognitive skills cannot really be taught, right? These are very experience-driven skills. These are very personal motivation driven skills because, for example, how you communicate is actually more defined by what you want out of your professional life than just your confidence or your English, because sometimes motivation pushes the mind to do what it generally cannot. So this is not a soft skills workshop, even though the title, I guess, is workshop for this segment. Now, I've been told that few of you are entrepreneurs, few of you are healthcare professionals. So it's a mixed bag over here. So this conversation between you and me is going to be about what are the soft skills and how they can be adapted and conditioned for achieving success in the world of healthcare. Now, success could mean success for your employees, if you are an employer, for you, if you're a professional, or any other role that you play in the healthcare sector. And I'm going to open it up for some introductions. So what I'm going to talk about today, take it as a quick peek into what are those skills that either you need to master or look for in your employees while hiring in order to ensure that you and or your organization remain professionally relevant in the new world. And I'll explain what I mean by that in a bit. But I just want to get a pulse of the audience. So I'm just going to randomly request a few of you to just tell me what you do, because I want to ensure that this conversation is relevant and contextualized, which itself, by the way, is a very important soft skill, rather than me just yapping away what I do and how I do, because why would you care about that? So I would start with you, sir. If you could just have a seat. Just tell me who you are and what you do.
Hakikat.
You are Hakikat. You are the truth. Okay.
Dr.
Acha.
I'm a medical professional.
Okay.
For last 2 years, I'm working with NLP. So we work with electronic health records from hospitals and clinics from US, and we extract unstructured data from their end.
Very cool.
And language models on it.
Yeah, no, I'm very much aware of this, but yes, so that's a pulse. Ma'am, you?
Hi, I'm Preeti. I'm working as a capacity building expert at National Health Authority.
Oh, nice. So you are responsible for ensuring how the healthcare workforce of the nation will be in the next 5
Yeah,
years?
related to the trainings and the workshops.
Yeah. So you're going to take some gyan from me and use it over there, I hope.
Yeah, maybe.
Cool. But you'll have to pay me in free healthcare access if I ever need in Delhi. What about you, sir?
I'm Dr. Rajat Sharma. Currently, I'm a medical doctor in University College of Medical Sciences.
University College of Medical Sciences.
Right,
Okay.
I'm doing my MD there.
Your MD.
In
Right.
community medicine.
In community medicine. Nice. What about you, ma'am? That's a lovely outfit that you have.
Thank you. Hi, good afternoon, everyone. I'm Dr. Vanshika Gupta, and I'm working with Piramal Foundation Program Manager and overlooking the RMNCH programs.
Nice. Yes.
Yeah.
I worked a lot with the Piramal Foundation
Oh.
in my previous avatar, back in the day, not anymore. What about you, sir?
I'm Dr. Raj. I'm working in Religare
Mm.
for a greenfield project. They are trying to establish rural OPD insurance. So that's my project.
Nice. So I've worked a lot with in rural training rural healthcare professionals through a partner organization, SEVA, Self-Employed Women's Association, where we train Anganwadi workers, ASHA workers, and of course primary healthcare delivery centers.
Yeah, previously even I worked for Koshi Baby, that's in Rajasthan, and Tata Trust in Madhya Pradesh.
Yes. Very cool. All really cool stuff, yeah. Is anybody doing something completely different that I should know? Who's probably not a doctor? Yes? Just so I don't know if there's an opposite vibe over here.
Okay,
Or a differing vibe.
my name is Guncha and I work with Clarivate as a...
With?
Clarivate.
Clarivate, okay.
It's an analytics company.
Okay.
And I work for US Healthcare, just working with the revenue cycle team.
All right. So you make money out of people falling sick.
No, we
Then
try.
huh?
So we try to streamline the workflows in the US hospitals so that patients are able to get the most of the care that they deserve.
Okay, that's a nice way of putting it. You already have good soft skills of presentation. All right, cool. Anybody else would like to introduce themselves, doing something different, interesting? Cool. Please, there is a mic there. I know he wants it in the camera. It's your minute of fame, man. Enjoy it.
Thank you. Hello everyone, I'm Dr. Aditya Bhandari. I work as Senior Program Officer in Maternity Foundation.
Okay.
It's a Danish not-for-profit, but we have an office in India and Ethiopia. We have a digital tool called Safe Delivery app, and it was launched by Government of India in 2017. And it's been used as a capacity building and a knowledge tool for healthcare work professionals.
Nice. Cool.
Yeah.
All right. So, let me give some context as to what I do and how it can be relevant for you. So let me start with a story of how my journey of doing this began. I've had 2-3 avatars in life. Before this, I built one of India's largest youth marketing and research companies, which was acquired by DDB Mudra, which is a very large global advertising conglomerate. And that experience taught me about the workplace and the evolving industry and so on. But what happened is, after I was done with the world of advertising, in fact, since you are doctors here, I can share that one of India's largest cigarette companies invited me for a pitch, and they said, basically they said, you understand youth, tell us how to peddle cigarettes. And that's when I left, because I didn't join the world of work to work with brands on how to sell candy, cola, and now cigarettes. So I had my moment of awakening, and I took out my earn-out money from that, sold the company, and I was looking for something to do. And I believe a lot in destiny and spirituality and the work and the conspiracy of the universe to get you to where it wants you to be. So I got a call from somebody who I used to know through my different social initiatives that, I read in the papers in Economic Times that, you've been acquired and you have lots of money. So can you come to Dharavi? So Dharavi is a slum that all of you know. And so he's basically one of a social worker in Dharavi, this gentleman called Sandeep Katke, who I had been introduced to through my work with the UN. And he said, can you come? So I said, okay. So first he took me to, a quarter bar. Does anybody know what a quarter bar is? It's a very Bombay thing. I don't know if it's in Delhi, where they only serve you alcohol by quarter. You can't buy a peg. You only can buy a quarter. So I think it was part of his plan to, get me a little tipsy. And then he took me for a walk to a school and a college. And he said, ये ना मेरा कॉलेज था, मेरा स्कूल था, और अब ये बंद हो रहा है क्योंकि महाराष्ट्र गवर्नमेंट ने मराठी मीडियम स्कूल और कॉलेज का फंडिंग हटा दिया है फॉर वॉट एवर स्ट्रेटेजिक रीजन. सो ही सेड कि यहाँ पे 150 बच्चे हैं, both school and college मिला के, it's a small setup. Bombay, if you've been, you'll know we don't have large buildings and large infrastructure. So he said that, can you do something? Obviously he wanted money. But I was looking for purpose. So I said, okay, how much does it cost? He said 8.5 lakhs to 10 lakhs per year is the running cost. I said, chal done. God has endowed me with a lot of money. I'll put 10 lakh rupees and I'll save the college at least for a year. But I put one condition with the management. I said, I'm not just going to put money and whatever. I want to come and run the school and college with you because I have a view of how kids should be taught. And I was a victim of a very draconian education system. So I wanted to kind of undo that karma and, you know, build ranchos and not chaturs, if you know what I mean. So I went, they said, okay, jo karna hai karo. Matlab, they were almost shutting down. So like, aapko jo karna hai karo. So I took over and I was de facto the principal for a year. A lot of things happened, but I'll share one highlight incident that got me to where I am today. And it might build context for you as well. So there is a young boy who comes, and if you will follow me on Instagram, that picture is there very prominently. Young boy called Ganesh who comes and, you know, sits next to me while I am eating my lunch in their lunch break. And he says, भैया ये कॉलेज जाने का क्या फायदा? So I said, क्या पूछ रहे हो तुम? It's like मेरा भैया जो है बड़ा भाई वो ग्रेजुएट हुआ इंग्लिश मीडियम कॉलेज से और उसको नौकरी नहीं मिल रहा है. तो मैंने कहा कोई बात नहीं, मैं बात करता हूँ लोगों से, नौकरी दिला देंगे. तो ही सेड नहीं, लेकिन उसको बोल रहे हैं 10 इंटरव्यू में गया और उसको बोला कि तुम स्मार्ट नहीं हो, वहाँ पर डिग्री है लेकिन तुम स्मार्ट नहीं हो. And I don't know what happened. Maybe all my experiences, my interactions with my clients through the Mudra initiative, Mudra company that I sold, I realized, yeah, that, and 2017. So I said, yeah, there is already coming a time where academic intelligence will not actually be a criteria at all for success. Sure, if you're a doctor, it's a different story. Obviously, you can't rancho your way through heart surgery. You have to be a chatur in that. But generally for the world, just academic intelligence is not going to get people anywhere. And Ganesh's brother, let's call him Ramesh for sake of the story because I remember the brother's name. There will be like millions of Rameshes, right, who are graduating from India's college education system but are not employable enough, because employment is a numbers problem. Because population control wasn't really our forte as a country, so we have produced millions and billions of people. Now that problem can never be solved. But there are jobs, and there will be more jobs. But we don't have able enough people, and ability is going to be increasingly defined by your ability to think, communicate, create, and solve, and not replicate. Because anything that can be replicated, ChatGPT is there. Let me give you a quick side funny story, and then we'll get back to this the initial line of thought. So we run a soft skills training company, as you know, and we had to build some assessments, and we needed to validate some theory behind the assessments. So I spoke to a professor, and he quoted me 9.5 lakh rupees. A PhD quoted me 9.5 lakh rupees. But one 17-year-old intern in my office said, no, we don't need to just feed it to ChatGPT and it will tell you whether it aligns to certain rubrics or not. And ChatGPT in 1 minute for free did what a professor was charging me 9.5 lakhs for, right? Because all I needed is validating the rubric of the assessment, which ChatGPT knows. So anything that can be replicated is going to be automated. So then 2017, I basically got the business idea and my purpose to enhance employability of India's youth by enhancing their general intelligence or workplace intelligence rather than academic intelligence. So that's how my journey began. And then obviously as life moved on, COVID happened, and I really believe that what I picked then, which was still nascent, is the need of the hour now, which we are here to discuss, is what really makes a workforce automation proof, right? And why is it so important? Especially for the healthcare sector, which is why I specifically came literally for 3 hours to Delhi to talk to you, 1 hour to you, 2 hours for another meeting and back. Because this is one sector where I believe that it is going to be the only sector where you will not be able to remove the human touch, right? Yes, a robot can operate, but after the operation, the patient will need a human to talk to, right? And for a doctor, for a nurse, for an administrative staff of a hospital, even if you are talking to 500 humans a day, each human will be a different story. You cannot commoditize, generalize, and I don't know the right word, so I'm going to say dataize your patients, right? Each story is a life in it. Each human is a life and a story in its own. So let's talk about what automation. None of us here are technical or technology experts, right? So let's not pretend, at least I won't. So let's get done with this automation part and then come to the soft skills part. What's happening now is that companies and businesses across spectrums are chasing efficiency and scale, right? So what a lot of HR heads of large to medium-sized corporations are saying, we don't want to hire humans for most tasks. And this will become increasingly so in the next 5 years, 10 years, 15 years. And the reason, can anybody guess the reason actually? Why are companies like, why are capitalists, why are companies saying we don't want to hire humans? They will learn and move on?
Routine tasks which can be programmed and replicated is what largely they're doing. For a lot of those stuff, they will be sizing down. Sure.
Yes, that is one point, which is correct.
Provision of benefits will not be done. Like benefits, we do not need to give benefits
To robots. Yeah, that's also one. But there is something which is more deeper and philosophical that caused all this. But you're right. You just pay a SaaS fee to an algorithm and you don't need to give it leave. You don't need to, there's no Diwali, Holi. It's a robot, works 24/7. But there's something more. Which started all of this? All of this is yes. But
Automated circuitry does a different part which can make it easier for a robot to be able to do it. Like it's expendable. You see your
yeah,
work is expendable.
which is also correct. But let me come to and this is something that I heard in San Francisco. So I was part of a Google fellowship and they took us to SpaceX, GoogleX, Tesla, and a lot of other companies. And one of the creators of AI, top 5 creators of AI said this. But yeah, you want to add?
So first is that they'll not need a constant talent pool for recruitment, and second is they'll not have to upskill and see that everyone is at a
Correct.
skill level.
All correct. But there is something which is slightly controversial, offensive, but true. He said that people who actually govern the world as large business owners, political and politicians, think tank heads and so on, did a prediction that Gen Z will be one of the dumbest generations that is going to come out. Why? It's not the fault of a particular individual or a human, but just with the way the world is going, Instagram, increase in consumption of cannabis. These are all factors that people actually consider. So cannabis consumption is predicted to be at its highest and is going to increase. Content consumption is going to be highest and it's going to increase. Now you mix content plus cannabis, basically it means couch, right? And you're going to be dumbed down. Now I'm obviously kind of oversimplifying it in the interest of time, but the prediction is that 8 out of 10 Gen Z will not be able to effectively contribute. Systemic failure. It is not the failure of a particular individual. It is a systemic failure, but this is the way we are going. So then, in order to replace those who cannot think for themselves, who cannot think creatively, tactfully, strategically, at the base, for the base level work, automation has been brought in. Because work has to happen. All of the other reasons being correct. But it would have been different if we were one of the most intelligent, most innately intelligent generations. We were devoid of any influence and devoid of temptations of laziness and internet and so on, where we would rely more on our faculties. But just the way the world is today, we have stopped relying on our own faculties because life has just been made easy and there is no one cause for this, like I said. So in order to replace those from the Gen Z who cannot effectively contribute, and this has also been spoken about very, very beautifully in a book called 21 Lessons for 21st Century by Harari. I don't know if many of you have read it, but he has said that professional relevance, the most people will actually not be able to be professionally relevant, and therefore they're already thinking of a thing called universal basic support in order to basically put money in the hands of those who cannot or do not want to contribute in the world of work. So all of this resulted in creating this new species of job seekers called automation. And it's coming and it's going to stay and it's going to become even more prevalent. But new kind of jobs will be created, perhaps lesser in number, where the qualification, can anybody tell me in the age of artificial intelligence, what will therefore become the most important qualifications for new jobs in the age of artificial intelligence? Natural intelligence. Right? What is natural intelligence? If you break it down, if you look at the World Economic Forum's Future of Jobs report, it says that the top 10 must-have skills for jobs of the future include skills like critical thinking, problem solving, emotional intelligence, creativity, collaboration. These are all actually innate, right? If you study tribes, if you have to look at the root or the origin of mankind or humankind, you study tribes, and they have been creative because survival required creativity. They have collaborated because coexistence is collaboration and cooperation. Leadership, there is always a tribal chief. Entrepreneurial spirit, barter, right? So all of these that now have become, suddenly there are global conferences on this, like the Davos conference earlier this year was all about future skills, and soft skills or applications of natural intelligence were the core theme. But this is actually from tribes who were not taught. So these skills are going to matter the most, right? Now, look at a sector like healthcare. I think the marquee event in your careers, in your field, in the last 10 years obviously is COVID, right? But COVID showed one failure of the health system. Many failures were demonstrated, but one failure that is of interest to us. The inability of the healthcare workforce at large to handle emergencies, but more importantly, decision making, creativity. For example, okay, you have to create beds and you have to create some form of, the ideal way is not working. I mean, the hospital, the healthcare system is not been trained or created infrastructure-wise or human resource-wise to deal with what it had to deal with in terms of numbers, in terms of the uncertainty, like, even doctors, there was no manual given to doctors on how to deal with COVID as a disease, let alone it as an operational crisis. Therefore, it was highlighted that apart from medical excellence, which obviously is essential, doctors and hospital administration and all the other layers of the medical industry's hierarchy and workforce need to be trained in non-technical, non-academic skills, which you can call soft skills, automation-proof skills, and so on. For example, where would this be used, right? So I'm going to take very famous examples because I really don't know what is each one's individual awarenesses. To convert a stadium into a hospital is creative thinking and jugaad, right? Cardboard se bed banaya, wo jugaad. The interesting thing though, which I cannot state it as fact, but I heard it at a conversation. I was at a party where the Maharashtra government's health secretary was there. This was just after COVID, when things were open again and people were drinking and partying again. And I was at that party and he said, actually jo ye sab solutions the na, non-medical log ne diye. So in Bombay, an event management agency, which obviously didn't have any other business at that time, was hired to basically convert makeshift event venues into hospitals. So doctors would obviously give their medical protocol. So there's a company called Cineyug, which is very big. They own something called the NSCI Dome, which is on Worli Sea Face for those who've been on Haji Ali. It's in NSCI. It's a big party venue. Big concerts happen there. That was converted. So the event agency did it. Or it was basically coders and tech guys who basically figured out an entire allocation system for hospital bed management and eventually obviously vaccine, which is the COVID app that we all had. Now, this exposed the urgent importance for non-technical training. So I'll give you a very interesting example from in my own journey. We were invited as a company by Gujarat Adani Institute of Medical Sciences in Kutch region to train their doctors in soft skills, right? Resident doctors who are, I guess this is people who are still, they're doctors, but they're still doing the residency, so they're not really working, but it's part of their training and as well as their work. Yeah. And what they came and told me is, so very interesting question somebody asked me, said, there are two patients, there is one bed or one ventilator. Can you give us a formula to make a choice? Because often in their careers and during COVID, they found people who were both equally, the parameters were equal, chances of survival, chances of death, age, everything. He's like, is there a formula? Because we as doctors are not taught to make that choice between two people. We are taught to make a difficult choice when it comes to a surgical procedure, yes. But if there are two patients, who do we choose if there is limited resources? And that question got me thinking, yes, I'm sure this happens in the lives of so many medical professionals because resources are always scarce. So then how do you teach creative resource allocation? How do you teach prioritization? How do you teach, from an entrepreneur, medicine is also business. So what choice makes better business, and in a good way? We're not talking about the ethical side. So that made me realize that how these skills are actually so prevalent in your specific careers. But I'll pause here at the moment. I would love to discuss, and I want you guys to bring scenarios to me so that we can have an open conversation, because I just wanted to set the context on. Can you share instances from your careers, from your experiences, where you felt that either you wish you had non-technical ability, or you wish somebody else you work with had, and let's dissect that scenario and see how soft skills actually bridge the gap. Would anybody like to start? Any situation in your career, in your experience, where you wish skills like critical thinking, creativity, or problem solving could have added value, but it was not present? Think, there has to be something. Don't tell me all your lives are straight, man. Or there's been no problems. Come on, you, yes.
So, I am a co-founder of a company called Clinical AI Assistance. So, I usually have almost daily meeting with, co-founder or the leads of different teams.
Yeah.
So, there have been many times I used to, always think like I am some sort of superior to them, and more likely I think taking more better decisions than them. So I used to have many times argument. It's not like all we want is what is right at this point. We want to take it up. But sometimes it's like who is right now is what conflict between these two. What is right now versus who is right now versus. So these two things bothers me a lot. But then finally I come out when we have a lot of arguments. We take 3 people outside from the team and take what their feedback is, and we go around that. So this is how. So I used to have how we can come out of, some sort of a common place when we'll have arguments. So this is one thing I often face.
It's a very interesting example, and no offense to anybody here. But in certain professions, one of the greatest soft skills which is lacked is intellectual humility. So a doctor will say, I am a doctor. Lawyer will say, I am a lawyer, I have studied, I am from, OP Jindal Law School. Doctor will say, I am from KEM, who the hell are you, right? But as the medical world increasingly becomes a business, it is becoming a business even more and even more blatantly. So you're going to have investors, your patients are also your customers now. Because today a medical business is not just a hospital, right, or a clinic. It's an app, it's a software as a service, it's nutrition, it's wellness. So for example, we were brought in to help with one company. So they're a company that provides nutritionists and healthcare coaches through an app to a large customer base. But obviously now customers are not going to accept just any recommendation as gospel truth. So they started arguing and questioning. But these nutritionist experts, and they also who are also happen to be doctors in many cases, started having the holier than thou attitude, that who are you to question what I am saying? Because nowadays what happens is patients also or people also go and read something on Google, they get some half knowledge and they start questioning, saying why this. So this one particular really funny episode that is really funny is basically one person started arguing with the doctor saying, hey, why are you saying don't drink alcohol? It is proven that red wine is good for the heart because it has resveratrol. Now, obviously, you need like 50 bottles of wine a day to get the resveratrol amount of resveratrol you need actually. So therefore, you have a pill. But now you can't like, you know, the way you respond to that patient. So apparently, this so-called doctor in that company said, you know, then something they said, you want to be a Devdas or do you want to be the opposite of Devdas? I don't remember, because that guy was basically insisting that his diet plan includes red wine. Now he's a customer. He has paid this app some 25,000-30,000 rupees a year for healthcare advice, but he also wants to ensure that his own lifestyle choices get validated through this app because he has paid. Right? So to cut the long story short, from your scenario, intellectual humility is going to become very essential for you in your business, even though you 100% know more, studied more, and have done more, and have more data at hand, actual data at hand, but that no longer can be your trump card. Anybody else like this to share that we can make a learning out of? Some episode? I'll tell you an interesting one, because I looked at him, I remembered with one rural healthcare initiative, but I will wait for somebody to, yes.
It's a little longer. So I was working in a small district in Madhya Pradesh. So I was the district coordinator there. So
Mike me.
Hello. So I was working as a district coordinator there, and there were 10 sub-centers under me, and there was a rule that A&M would be getting a room in that sub-center. So usually no one used to visit those sub-centers. So what they would do is that they will occupy the whole sub-center. They'll make one room as a drawing room, other room as a study room and all. And there won't be any functional utility of that sub-center for the beneficiaries. So when I went on my rounds, I found this like this is wrong.
Yeah.
So I asked her to like vacate the place. I mean the extra rooms she occupied. But then she said that, and that A&M was from some other sub-center. So I made this complaint to the higher authorities, and later on I came to know that the higher authorities allowed her to stay there in terms of some sort of exploitation.
Wow.
So then
this is going another zone.
Yeah.
So there's a much like story like that IAS officer that we're reading about right now, who exploited position.
Yeah. So then I was like so much filled with guilt that what should I have not said that? Should I have done something else? Or could there be a, I mean, neither black nor white, some gray line? So I mean, there was no solution for it.
So there's a very so you actually brought a very interesting point, which was going to be my next point. But I'm going to take a funny example with rural healthcare, and then come to the point about the next soft skill I want to talk about. So so what happened is we do a lot of work, like I said, with Seva, where we train ASHA workers on soft skills and so on. So we were getting into what are the problems, like to understand the area of intervention. So we had to do, as part of our work, we had to do a study with patients or people who have been patients of the rural healthcare, primary healthcare delivery in that particular region in Gujarat. So I read one story which my team collected when they went to the village and spoke to the residents. They said कि एक बार हमने WhatsApp पे, so I think in that village they introduced with one very forward initiative by the government, mobile healthcare, tele-healthcare, right? So where you don't have to always go to a doctor, because in rural areas reaching is a problem due to lack of transport and distances. So for certain simple diseases, you know, you can get advice online. So we had to basically improve that delivery from a non-technical standpoint. So we are trying to understand the problem. So one very funny thing happened. So one very funny problem, I found it funny at least. So the story goes that somebody was really sick and was getting shivers and rigors. So they kind of WhatsApped. There was a WhatsApp channel where you could WhatsApp the doctor and the ASHA workers what is happening and await advice. So WhatsApp किया, किसी ने कुछ advice नहीं दिया. Now the patient also did not use their brain, which is a separate problem. But they said कि हमको 24 घंटे तक कोई reply नहीं आया. ठीक है, तो ये सब बेकार है, हम तो हमारे वैद्य के पास जाएंगे, क्योंकि हम ये सब में मानते नहीं. तो ऐसे 24 घंटे तक रिप्लाई क्यों नहीं आया? That's what my person asked. So then we took these problems And then we asked the healthcare workers and the primary healthcare employees over there that, we got this one situation and look, he said, हाँ, उनको हमको phone करके बताना चाहिए ना कि उन्होंने WhatsApp भेजा है. Right? Now, why this is funny is that on one side you are saying that you want to improve technological delivery of healthcare, but on the other hand, the healthcare professional therefore also has to be trained कि you got a WhatsApp, you reply on the WhatsApp. Now, I wanted to use this example to talk about a very important thing, not communication but storytelling, which is going to become the most important soft skill for healthcare professionals. So creativity, jugaad, all of that, yes, but storytelling, not communication. So this will address your point also. Now, why storytelling? Can anybody explain to me what they understand by storytelling? And I'm carefully not using the word communication.
Just mind everyone, because everyone can relate to their, story in general is someone everyone hears throughout their life.
Yeah. Good point.
It comes in interpersonal experience.
Yeah.
You sort of tend to attach some ideas of relatability
Yeah.
to it, wherein you relate to their pain also, that matters, or the hope of honestly receiving
Yeah.
sort of better health outcomes
Yeah.
after receiving treatment, so to say.
Yeah.
So largely when we're trying to curate even elevator pitches
Yeah.
or anything essentially, we try to show the problem that we're solving through, of course, just create a story.
Yeah. So good points. So stories are the most primal way of communication that all of us have been used to, right from our grandmothers telling us stories, and right from when we were Neanderthals, we used to draw stories on rocks. Now, recently, my pune in my office has been very sick, okay? Where he's lost weight, so I'm very worried, and he's been with me for 5 years and takes very good care of me. So I sent him to a doctor. Now my own doctor is a female doctor, so he's like, नहीं मैं ladies के पास नहीं जाऊँगा, मुझे कोई gents doctor लाओ. So I found some senior male doctor and I sent him. That called me एकदम डरा हुआ. मुझे लगता है मेरे पास अब ज़्यादा वक्त नहीं बचा है. तो I said क्या हो गया? He said नहीं, डॉक्टर बोला शायद मुझे HIV AIDS है या तो TB है. And I'm like, ये कैसे हो गया, मतलब how did we reach here? And then I called the doctor and he said, no, I just told him that, he has lost weight and there are 3-4 diseases that can lead to this if there is no other cause. So that made me realize, as a recent example, that medical professionals need to know to contextualize their communication, to a patient who firstly is semi-literate. Secondly is any case, मतलब आधा पसली हो गया और तुम उसको ऊपर से HIV और TB बोल रहे हो सीधा, वो भी बोला नहीं उसने. They said, ये, the doctor was trying to be medical and say, ये हो सकता है. बट इसने यही पकड़ा, बिकॉज फिल्म ही देखते हैं सब लोग, तो फिल्म में टीबी, HIV एड्स, उस पर तो कितने पिक्चर बनी है. नाउ व्हाट हैपेंस इज, इट्स लाइक वन डे माय CA टोल्ड मी, सो द सेम प्रॉब्लम एग्जिस्ट फॉर फाइनेंशियल प्रोफेशनल्स ऑल्सो, सो वी रेज द राउंड ऑफ फंडिंग एंड ही सेड अगर आप ये नहीं करोगे ना तो ईडी की रेट पड़ जाएगी, इनकम टैक्स वाले पीछे पड़े आजकल. एंड आई एम अ स्टार्टअप फाउंडर, डू नॉट अंडरस्टैंड ED, IT, व्हाटएवर, एंड सडनली उसे ऐसा करो तो ED रेट पड़ जाएगी, विच इज अ ह्यूज हाइपरबोले. Now, if you look at these examples, as medical professionals, your job is only to deliver bad news. That's what you do. You give bad news. No one comes to you when they are like, hey, I'm healthy today, so I've come to see you. वो तो है नहीं. Your job is only to say, तुम्हारा ये problem, वो problem, इतना खर्चा, उतना खर्चा. तुम्हारा काम वही है, right? The ability, as she rightly put, but we'll go one step further. All medical professionals will have to develop the ability to contextualize their narrative based on who they are talking to, what their mindset is, what their reality is. Let me give you another example, because this is, according to me, a place where healthcare professionals world over, in fact, it's not an India problem, need to really upgrade themselves from a soft skill standpoint. Otherwise, chatbot. So here's the story. So I was in Ahmedabad, where my half side of my family is from. I'm half Gujarati. My grandfather was, and we are the part trustees, our family of the hospital, so we were getting all VVIP care, blah, blah, blah. So I'm sitting outside, doctor hasn't even come out and asked me क्या करना चाहिए, क्या नहीं, कितना खर्चा करना चाहिए नहीं, because he knows कि the best has to be given to my grandfather. But I was sitting outside waiting, he was in a angioplasty. So this same doctor, who is going all out for my grandfather, comes out and there's another young boy, okay, younger than me, and that time I was 30, so he must be about 25. Says, doctor comes and asks saying, तो आपके पास कितना पैसा है? So, and this guy clearly was not from a very well-off background. He seemed like from a semi-rural area or a small city in Gujarat, not from Ahmedabad, and not well-to-do that you can make out. So, कितना पैसा है? That's the first question. Come out of the OT, the kid is looking. वो भी डरा हुआ है, मतलब doctor, see, we all speak, we all are smart and all, but for somebody with less exposure, doctor is like God or devil, whichever way they choose to play. And so कितना पैसा है? He's like, नहीं sir, क्या हुआ बोलिए in Gujarati. देखो, 2 लाख का स्टेंट हो गए तो 4 साल जिएंगे, 5 लाख का स्टेंट हो गए तो 10 साल चलेगा. आपको कितना चलाना है आपके पापा को बोलो. That's the conversation. Now let's forget the meanness of the doctor in this. We leave that out because that's a human problem. You can't say to any patient, whether it is Akash Ambani or some nobody, you can't equate life to, or the life expectancy of a stent to life of a patient to money. You just can't do that. Because that is going to be very counterproductive for so many people. Now, maybe the doctor is not a bad guy. Let's look at it in a good way. He's just saying, boss, this stent, this cost, this expectancy. He's giving a rate card, but you can't. You have to storytell. Right? Because I saw that boy and I took the privilege of being the trustee's grandson and said, I don't think this is the right way. And I called my grandfather's secretary who works in the hospital and I said, please figure it out for him. Because the guy was shaken. And that also experience from which I learned, and we included these kind of simulations. So we train through simulations. So when we did the Gujarat Adani project in Kutch, we actually created these simulations where we trained resident doctors कि ऐसे situation में तुम कैसे बात करोगे patient से. Because sometimes, now let's go deeper into how do you storytell. So that's the technical bit that I'll get into in this short workshop. There is a specific thing that you have to use, and that is called keywords. So the tact here is, now keywords are not jargon, they are not fancy words, they are not nice words, they are keywords. Keywords are essentially, think of it as keys into the mind of the person you are talking to. Now if you have a specific agenda, let's be brutal here, you want him to spend 10 lakh rupees on your product, on your device. Let's go with the extreme. What will you say? आपके पापा को best treatment देना होगा. Instead of, flip it. I'm giving very simple, I'm giving an oversimplified example. Or if somebody is going to live for just 2 years, you literally say you're going to have the best 2 years of your life to start with. So you have to understand what will be the trigger word, and how do you develop that understanding? You have to, what I started by saying, look at each person as an individual and not as a data set. So you will have to, so I really liked, let's look at what good some doctors do. I've only been pissing on your profession so far. My doctor, I watch her interact with other patients. She'll get into understanding their lives, their businesses, their diets, their family ecosystem, what music they listen to. So now you've developed an understanding of the person and you will find something. So I used to be a massive cigarette smoker. Okay, I used to be a chain smoker. And she's like, bro, you need to quit. But she didn't tell me you will die. You know what she told me? And I'm going to share it very openly and no offense, but I promise you it worked. And sometimes these examples are the ones that make the most point. She said, Samyak, you know the problem is cigarettes lead to erectile dysfunction. अब तुम एक यंग लड़के को बोलोगे ये तो छोड़ ही देगा ना वो, बाकी कुछ नहीं चलेगा. But she's smart because she knows my life, she knows my relationships and so on. It worked, right? I have not touched a cigarette after that, I promise you. It's of course the will, and I was not really addicted to nicotine, it was more the experience of smoking, so I didn't really care about the nicotine itself. But it worked, right? Or she told, my sister was not very, she doesn't have very bad eating habits. But she knew that my sister loves children. So she spoke about childbearing ability. And she had a very general conversation about, I have this data that women below the weight of XYZ don't end up having successful pregnancy. She didn't even tell her this. It's for her. She just, in a conversation when we go for our annual health checkup, she just made that passing. Now, why did my doctor do all this? We don't pay her more money. We are not any special patient than her. I had this conversation because I told her what I do. She taught me this. She said, she spoke about without using the word storytelling, that basically doctors or medical professionals have to become manipulators. You have to learn how to manipulate who you're talking to, hopefully for good reason. But let's talk about the tool and not whether it can be weaponized or not. Let's talk about the tool, manipulation. So storytelling, you have to understand what are the keywords. And many of you work in rural healthcare setups, and there, for example, if you want to get women to consume more iron, because anemia is a huge problem for women in general in India and rural in specific, create stories. Like, for example, I am part of something called Ashoka Center for Social and Behavioral Change, also funded by Gates Foundation. And I'm on the advisory board. And there's a very interesting project where they're trying to put palak into religious folklore. They are creating, so they are trying to do an experiment where they go to a local village temple and they get the young kids over there to create a new, song for God. And in that they put palak and iron. It's an experiment, but it's a brilliant thought. Because if you suddenly go to a rural area and tell all the women कि आप पालक खाओ, कोई कितना मतलब पपाई भी उतना एक्चुअल में पालक नहीं खाता होगा जितना खाना पड़ता है. आप IFA टैबलेट लो, then the problem is there is a problem with the stool and so on. तो उसके लिए भी तुमको कहानी क्रिएट करना पड़ेगा. So storytelling, guys, if there's any one takeaway from this very brief session that we are having, develop or look for the ability, develop in yourselves, or when you're hiring, look for the ability to storytell. And in your profession, storytelling has to be mixed with the application of empathy first. Sometimes I know as professionals, you yourselves are stressed, you yourselves are overburdened and probably are extremely frustrated and angry and everything. Therefore, you have to develop the ability to act. So what I'm doing here for a client of mine, we're actually taking a theatre actor to train nurses on how to act. So, because otherwise nurses are also humans, they deal with 12 hours a day, 20 patients, 30 patients, 2 dying every day. What do? You have to develop the ability to disconnect what you show from what you think and feel. Right? So storytelling and a bit of method acting. And that's the biggest idea and takeaway I'm giving you. If you can do that, you will be a cut above the rest as a medical professional. But I'm going to conclude this, and we'll also do some Q&A, by giving some tips on how to hire right. Because all of you somewhere will be hiring also in the medical field. So what do you look for in soft skills? I hope I've convinced people that soft skills are essential for healthcare. And I think all of you would have already been convinced, which is why you're sitting here. But what to look for and how? First, purpose. There's a whole different workshop altogether on purpose. But very quickly, your profession, education, and food are professions where purpose matters most. Why? Why did you choose to run an education company? Why did you choose to get into healthcare? Why did you choose to start a restaurant? And the answer somewhere has to be linked to joy of making other people happy. In education, my purpose is I want to ensure Ganesh's brother, Ramesh, I exist for him. You have to exist somewhere for providing or democratizing access to high quality cure. The food guy has to exist because he loves food. The business part, everything, economies of scale part and all come later. So purpose. You have to check for purpose. When you are hiring, it cannot be just money in your profession. Because purpose is what will drive and push the mind to become that storyteller, to become that jugadu, to become that actor. Because purpose is what pushes the mind consistently and incrementally, not money. Right? So look for purpose. Now how do you look for purpose? You can't say what's your purpose. You have to understand their prior life before they met you. So you will nowhere ask what your purpose is. You will try to ascertain yourself कि तुम यहाँ क्यों काम किया, यहाँ क्यों ज्वाइन किया, यहाँ तुमने क्या सीखा, यहाँ तुम्हारा एक लर्निंग बताओ, क्या क्या करके तुम्हें, what is the most joyous moment in the past job, what is the worst moment of your past job, and then you deduct if this individual is purpose driven or purely transactional. You cannot hire purely transactional, or you yourself cannot be purely transactional as a healthcare professional. That's first. Second, you have to look for jugaad abilities. So purpose driven, then jugadu. Because resources will always be scarce, time will be scarce. Right? Now you have to check that a person's ability to still churn butter out of milk, even if there is not enough milk. How do you do that? Now, this is the interesting part. If you are interviewing as an employer, you will have to first simulate certain scenarios in your specific subfield where jugaad is required and literally ask them how they would deal with it. If their answer, and you're looking for the right answer, because their main doesn't have to be a right answer. If their answer is somewhere they are willing to take a smart cut, they are willing to bend a rule, and I'm saying this very carefully, because look, again in your profession, a lot of things happen on the spot, on the fly. You can't have people who just stick to rules. नहीं boss ने यही बोला, यही process है, तो तुम robot आ जाएगा ना उसके लिए. You are here because there is no manual for what the situation you are in. So you can't have people who just stick to rules. So you have to see their ability in conversation when they communicate to you, their ability to bend rules. I'm telling you, this is, if you find people who know how to bend rules, not law, but rules and process, to get to the same outcome, they are winners. Especially when, for example, you know, as Piramal Health, you work so much with government, you work so much with the public sector, things don't move straight. So you need people who have the ability to adapt and respond and not get frozen saying, no, but this is not part of my training manual or process, laid down processes. Right? Third, obviously storyteller, which I will not go further into, we spoke. So purpose driven, jugadu, storytelling abilities you got to check for. And fourth, which is there on one spectrum a lot and then also not, which is entrepreneurial mindsets. So obviously doctors are the most entrepreneurial people I know. I mean that nexus between like labs and doctors and all is too good. Like matlab, you know, my best friend is a doctor, he's a stroke doctor, and he said, you know, तू ये healthcare center पे जा और तेरा diagnostics के लिए और मेरे नाम से जो 20% ऑफ मिलेगा. I said कैसे? He said क्योंकि मैं मेरा 20% तेरे से नहीं लूँगा ना. तो मैंने understood कि पूरा गेम है, अच्छा गेम है, कुछ गलत नहीं है. But if you look at hospital administrators, if you look at nurses, they don't have the entrepreneurial. Now, entrepreneurial mindset is not making money. It's basically a growth mindset. It's basically where, for example, let's move outside money. So I was in Breach Candy Hospital recently. For one of my relatives was going through a bypass, and I was sitting in the room. Now the nurse. So Breach Candy, I guess, I don't know if many of you know, is one of the most fanciest hospitals in Bombay, and they have this new wing. So I said, so she comes in and comes for the lunch order. So hospital food, everybody knows how it is, but she's kind of talking about like, you know, sir, would you like to have grilled fish with tamarind sauce, or would you like to have some prawns with butter garlic? And I'm like, I literally joked saying, where is this coming from? Like, no, our canteen. So now, one is of course the hospital introduced a better canteen. But then I asked her saying, you know, why are you, why are you taking an order like a waitress? And it's my job to ask these questions because this is my field of profession. She like, and I told her what I do. She like, see sir, we have just opened a new wing and it is expensive. And I want people to keep coming. So I need to ensure that they also feel like this is a hotel and not just a hospital. Because somebody who's paying 20K a night wants to also feel like a guest of a hotel and not just a patient in hospital care. And the nurse understood this. And that's very important because the person dealing with your customer or your patient, even if they are a medical professional or a nurse, if they don't know that, guys, this guy is a source of income, Therefore, I need to ensure comfort, I need to ensure a great conversation, whatever may be the context, and not just do my bit and get out. That understanding is very important. So entrepreneurial mindset is what you got to check for. These 4 things, in my opinion, is what will ensure that you as healthcare professionals or you as founders will have an automation proof workforce where you will be able to do or have people who can do beyond just bots and be able to build lasting relationships with your customers, beneficiaries, patients, whichever way you look at it. Because I would like to conclude by saying, at the end of all of this, the most important currency in your business is what? Not money, trust. And trust is only built through soft skills and the human touch. And that's a short sneak peek from me into why soft skills can boost your respective businesses or careers. But some questions, please. Any questions? Yes.
If you can elaborate more on trust.
Trust.
What is that thing which gets to people to trust each other?
In my opinion, 3 things. And let's contextualize it to healthcare only. 1, outcomes. Have I received a successful outcome as a result of my interaction or transaction with you? So let me give you an example, a little different sector, but to drive the point. Why did a company like Byju's fail, according to you guys?
It failed the trust of its employees.
That is one.
It also did not deliver what it was able
To the learners. See, abhi investor chodo, employee chodo. Main thing is a education company exists for learners, pehle. Right? Pehle students. There was no data that proved that after doing the Byju's course, there is a significant increase in marks. Right? So why would somebody want to buy Byju's? The core of any business model of something like an education company is how many people are buying the course. Basically that. Baki sab baad mein. Coming back to healthcare, how many people are using your product, your app, coming to your hospital, whatever that may be your thing. They will only come if they see outcomes. Right? So you have to ensure that you or your organization are measurably delivering and measurably communicating the outcomes. That's the first part. The second, like I already said funnily, no one's coming to you because they're happy, right? They're coming to you because they have a problem. Are you a good listener? Are you a comforting presence? And maybe you are not, so you have to learn how to act comforting. Maybe you are an a-hole in your head. But that's okay, you can be, no problem. But to them, you have to be God. You have to play God, you have to play friend, you have to play brother, you have to play sister, whatever that you need to play, shrink. So, can you create comfort? So, outcomes, comfort, and 3, and this is the tricky part. Can you mask the need? Can you mask money? Let me explain what I mean. See, all of you are going to take money. You're a doctor, you'll take money. You do surgery, you'll take money. But something one tarot card reader and a spiritual person taught me that you can repurpose. So I said, so I went for a tarot session. Very nice lady. Most of it was correct. Great vibe, like, you know, like simple white sari, everything. So I said, ये तो पैसे के लिए तो नहीं कर रही होगी. So सब हो गया. She's like, so now it's time for the energy exchange. So for a second I'm like, energy exchange? Like what? Like, what are we talking about? She's like, see, I gave you my spiritual wisdom. I don't want money from you. But money is a form of energy. It's a form of gratitude that you must express. Basically, she's asking for $2,000. But I'm like, ये बढ़िया तरीका है because she also knows ना कि ये तो tarot करने आया है. मैंने भगवान की बातें की है, universe. उसमें, you know, money is not really godly or spiritual. It is in fact there's nothing spiritual about money. But she masked it because what she basically said is that I've given you my time, I've given you my insights, you have to give me something. तो गुरु बोलता है दक्षिणा. दक्षिणा क्या है? फीस है ना, basically. Long story short. So how can you mask asking money? Because the moment you ask for money as a doctor or a medical professional, you have lost trust. ये अनफॉर्चुनेट रियलिटी है, लेकिन आपको पैसा चाहिए भी, वो देगा भी, लेकिन अगर उसके मन में आप उसकी जान बचा रहे हो और आप उसका 2 लाख का पूछ रहे हो तो नहीं बैठता वो. So I'll give you a quick example. So when we were exploring bypass for this breech candy uncle, there were 3-4 doctors, right, who were the top doctors in Bombay, and one name came which I won't take. I don't know who knows who here. And one name came. At least 4 people said no, but you know what? He'll open your body, then come out, ask for money, and only then sew it up. Now that's the reputation this fellow has made. I'm sure he actually doesn't do that, but just the way he talks about money may have created the impression about it, right? So I hope that answers your question. The third part is trickiest. First 2, I'm sure you can learn how to act and be all as friendly as possible. I'm sure you'll do good and deliver outcomes. But mask money. Even if you are people in the not-for-profit sector, when you're asking for grants, you have to mask it. Or if you're a business and you want investment, you have to mask it. You have to say. So I'll tell you, my best friend was a doctor. In fact, very interesting that he just flew in from the US for a medical conference at AIMS tonight, and I'm also in Delhi. So I'm going to see him for a beer before I fly out. So he has built one of the world's cheapest stroke stents, and he wanted to raise money for it, and he wanted to also raise part grant funding for his business, which is possible in the medical because you raise grant money for research and so on. So what he goes and says, he wants to build $1 billion business, and that's cool. I want to democratize stroke care so that every common man can get access to a cheap stent. कौन ना बोलेगा ऐसे vision को? कौन ना बोलेगा? Then they'll get into the product, the delivery model, blah blah blah. But first they'll see you as a visionary. अंदर उसको मालूम है कि strokes बढ़ने वाले हैं क्योंकि stress बढ़ रहा है, sugar consumption बढ़ रहा है, तो ये अच्छा business बनने वाला है. But वो आपको दिखाना नहीं है. That. Any other question?
Samyak, I have a question for you.
Yeah.
My question would come from my area of practice, which is AI in health.
Yeah.
Okay. And regularly when we sort of deploy the solutions, right? I'll not take names again, and I'll give you a scenario. Let's say we are diagnosing oral cancer through image-based AI tech. Right?
Yes.
And whenever a diagnosis is sort of given, let's say by the doctor, and the AI gives a different diagnosis, right? There's a double-minded trust problem. One is how does the doctor trust the AI, and who does the patient trust? Right? Cool. So, and this is a very sort of in the deployment area. This is a common factor that I see.
Yeah.
So I thought that I just pitch out a sort of a case.
Yeah, I don't have an answer obviously because this problem is actually so it's very interesting you say this. Last night I was at a dinner in Bombay where there's this company which is basically image scanning of millions of Indians, free eye scanning for millions of Indians because it has been mandated to create data points for delivery of AI-based eye care in the US. But I won't name, but so they're doing this, and we're talking about this exact problem. Ki, it's a black hole, right? Because, in my opinion, therefore, one answer, which is not a straightforward answer, is linked to his question. The doctor has to demonstrate that he knows what he's talking about. So he has to storytell. The doctor has to show surety. For lack of a better word, fake it till it's make it. I mean, what else do you do? Because AI itself is one black hole that is still forming. So how it thinks, it's a black box. So LLMs are a black box. Beyond a point, you don't know how they are functioning, what they are thinking, and what they are going to do. Therefore, you have to be the ISI mark for the AI. There's no other choice. You're the way you talk, the way you communicate, the way you sound sure. Yeah. So you have to be a bit of a politician. Yeah. And you also dress like one.
So how to identify these keywords, given that you are talking to a stranger you have met 5 minutes ago?
Very good question. Are you married?
No, I'm not.
Are you dating someone?
Yes, I am.
So how did you meet her first?
On Bumble.
On Bumble, right? So great. So then you met her for coffee, right?
Right.
And how long did it take for you to crack the deal?
1 day.
1 day, right? So you can do it. No. So, but it's the same thing, no. So you meet a patient for 5 minutes, 10 minutes, decide 5 questions to ask. You can actually develop a formula. Now, I can't help you there, A, because I charge for it, and B, the medical field, I'm not something that I'm as very, I don't understand the context, so I won't give you wrong advice, but I'm sure if you want to know, for example, what the person's thought process is when it comes to health and food and whatever, if you want to know their payability, if you want to know their openness to tough news, tough prescriptions or recommendations and so on, you can create some questions that you ask, which are not straightforward questions. And let me give you one tip though for free. The first part, in order to fully know a person, is you have to first make them vulnerable, which is why I asked the dating question. First you have to make them vulnerable and comfortable. So you share something about yourself. Even in a patient, like you can say, you know what, I mean, lie, say, I was obese and I did this and now my transformation. Something to show that you're also weak and vulnerable. Half the deal is done there, because then when you ask these 3 to 5 questions, they will answer honestly and you know the person. Yeah? But you cracked a deal in a day, even I have not been able to, with this soft skill gyan. So I am sure if you repurpose, like I said, sometimes, there are so many things that we know in our daily lives actually, but we don't use them in our profession because a wall has been created. Because somewhere we've been programmed to think that this compartment and that compartment are 2 different things. No, doesn't have to be that way. I hope that answers your question conceptually. Yes.
Can I share one anecdote?
Please.
I know I'm digressing a little.
No, it's almost the end and it's 4 o'clock. Yeah. No, yeah.
You talked about intellectual humility, right? And like how like we have this मैं doctor हूँ, मैं lawyer हूँ, मैं तो मतलब for example taking an example of the healthcare system only. So I have worked in rural settings and there was this one place CHC जहाँ पर बंदरों का बड़ा आतंक रहा.
तो बंदरों का बड़ा आतंक रहा था, तो जो सीएचसी के ऊपर पानी की टंकियां होती हैं वो उन्हें तोड़ देते थे. लाइक दे यूज्ड टू लिटरली ब्रेक देम एंड लाइक देन वी वर ऑल सिटिंग इन द सीएमओज ऑफिस एंड वी वर ऑल टॉकिंग कि कैसे करें, क्योंकि दिस इज नॉट मतलब टंकी हमने चेंज कर दी, देन हाउ इज इट गोइंग टू वर्क, मतलब वो फिर आके तोड़ देंगे. यू कैन नॉट कंट्रोल मतलब द इन्फेस्टेशन ऑफ मंकीज. सो वी वर ऑल थिंकिंग लॉक लगा देते हैं, जाली लगा देते हैं, मतलब द सोल्यूशन हैड टू बी इकोनॉमिकली वायबल ऑल्सो एंड मतलब इट हैड टू सॉल्व दिस थिंग ऑल्सो. सो किसी का दिमाग नहीं चल रहा हम में से. लाइक हम सब डॉक्टर्स बैठे हैं, सीएमओ इज ऑल्सो अ डॉक्टर, तो और एडमिनिस्ट्रेटिव. तो वहाँ पर एक आशा दीदी थी, तो उनसे भी ऐसे हम बात करते थे, अरे दीदी आप लोग इतना क्या टेंशन ले रहे हो इस चीज़ में, बस एक लंगूर की फोटो लगाओ ना. Basically, monkeys are very afraid of langur. So, what they did, this was in UP. एक डिस्ट्रिक्ट में उन्होंने एक आदमी को लंगूर बना के रखा था, which really like saved the entire CHC. And क्योंकि वो possible नहीं था यहाँ पे जहाँ पे मैं काम कर रही थी, they got this cutout of a langur and उन्होंने अलग अलग जगहों पे लगा दिया. जुगाड़. Exactly. And she gave us like the most cost efficient with no harm to any human, and मतलब हम सबका काम बन गया. So we could not have ever thought about it.
Because you are not trained to think so basic.
We could not have thought.
Big solutions and strategic.
Yeah.
No. And so I also saw this in Mamla Legal. There's a show on this thing where they in the court there is a infestation of monkeys and they bring a langur. So yeah.
I think this Mamla Legal.
हाँ वही Mamla Legal है. Yes. Any last question? Last question.
So that is why I just wanted to share this funny.
No, I think this is a great ending that proves my point completely. That is natural intelligence. No more questions. Great. I will be available on LinkedIn if you guys want to remain in touch. Thank you so much for being a great audience. I know it is 1 hour, so I can't really give you any tangible takeaways, but this was just to spark a thought into a field that you might not actively think about. Good luck. And if ever I have a medical need, I hope I will reach out to either of you. Thank you. I hope not, rather. Cool. Thanks.
Well, thank you so much, Mr. Samyak, for this dynamic session exploring the skills that AI cannot replace. Key themes of emotional intelligence, creative problem solving, and the art of storytelling have indeed been thought-provoking. And we're really thankful for these insights that you've gained into basically thriving in the age of AI. Last but not the least, thank you so much for this engaging workshop, and your contributions and insights at large have also been extremely valuable. We hope your takeaways have also been equally enriching. Thanks so much, everyone.